A lot of bad news have been coming out of Haiti, and that may make someone more prone to think that there's nothing positive coming out of this country. But St. Boniface has been there for more than 30 years, serving the poor and making sure those downtrodden people, those who can't get access to any care anywhere else, get the basic and high quality care that they need.
I mean, we see it all around Haiti, or in places where there's limited access to quality care. Right? People are dying of illnesses that they shouldn't die from.
Disparities of health outcomes and disparities of risk are one of the biggest human rights problems facing our species.
To be Haitian, to be poor, to be living really either urban or rural is to be really at risk for so many preventable and treatable illnesses. And St. Boniface is really the only place in the southern peninsula that actually provides quality healthcare and affordable healthcare.
The 2.5 million people who are in the southern peninsula have no other options. We're it. We have to be there.
To achieve health equity, we have to, at first, recognize that there is health inequity, that there is a group of people who do not have access to care, and that we can't be okay with that in the world.
So there's like a million reasons why we should care about this. One is because it's the right thing to do. Two is because we believe in the common humanity that we share with others around the world. We can do something about this. We need to do something about this. We should do something about this, and it's in our interest to do something about this. So let's go.
But the reason we're going to turn it around is because we're going to have more examples like Health Equity International saying, no, that's not good enough for this person. I think that's a very powerful example.
Health Equity International stands out because of the longevity of the organization, the incredible leadership of the organization, the passion that they carry with them every single day to make sure that every single person that comes across that door will get the very best treatment that they possibly can.
And it is really about saving lives, right, at the end of the day. And that's what this is about.
So over the years, more and more people have recognized that St. Boniface Hospital treat them first and foremost with the most dignity and respect, while always keeping the cost of care for them at the very minimum.
I would say I'm most proud of the growth. That something that literally started in a room probably this size. Equity is providing the necessities for all people to be healthy.
Our entire team has made it their life's work to work on issues of health equity. Whether that's our pediatrician who's seeing a never-ending number of babies coming into the NICU, whether that's the surgeon who's woken up at 2 o'clock in the morning to see patients. It's all of our responsibilities to make sure we do whatever we can for our patients.
For me, health equity means justice. Health equity means that people have access to care, access to health care, which is a human right.
St. Boniface is a hospital that would never turn a person away because of their inability to pay. For me, that's really the meaning behind health equity.
Our mission at Health Equity International is to work until we realize a world where every single person has access to care, just like we would want for our own family members, for our own children.
Over the last 30 years, we've been able to make sure that health equity is not just a concept, but a reality on the ground in Haiti.